All right, welcome everyone to our first NIPS call, or National Internet Partner Services call of 2024. Thank you for joining us. We have a packed agenda that we're really excited about, so we will go ahead and get started. To start, we are going to hear from Darlene Turner-Harper about the Facilitated Partner Services interview practice session that her team is working on. Then we will hear from Wanda Jackson about some available trainings for DIS and local and state health departments. And then we'll wrap up with Frank about what's to come in 2024. So I am going to get rid of this and we will start. And I'm just going to get it into, hold on one second, the slideshow. Okay, I will turn it over to Darlene. Thank you.
Hi, good afternoon. My name is Darlene Turner-Harper. This brief presentation will highlight the skill building interview session focusing on building your skills around conducting STI and HIV interviews. This is an overview and not a replacement of the principles, practices, and pathways to disease intervention, also known as 3PDI, which is the Foundational Disease Intervention course for new DI professionals. Next screen. Next slide. DER Facilitator Partner Services Interview Practice Sessions is a skill practice session, which was created from the American Rescue Plan funding of 2021 due to the surge in new syphilis cases. The sessions are specifically designed for staff providing syphilis, HIV, and gonorrhea partner services. The virtual practice sessions use role plays for DI professionals, partner services staff to demonstrate their interviewing skills. State, territorial, tribal, and local health department staff and/or DI professionals counseling individuals diagnosed with a positive reportable disease. The local jurisdiction makes a decision of what diseases will be initiated for counseling. Next slide.
I'm sorry, I don't know why when I click next slide, it's freezing. There we go. Sorry.
No problem. So this will be the agenda. We will discuss the purpose, describe the why and the need, discuss eligibility, enrollment process and the format, and discuss the sharing of feedback to participants and supervisors. Next slide. The purpose of the interviewing practice session: for quite a long time, we have been looking at ways to expand the use of our field staff beyond the jurisdictions where they are assigned, because we haven't been able to place staff in every jurisdiction. The need arose to train local staff. We also recognize the need to support the training or mentoring of local DI disease intervention staff, especially given the American Rescue Plan funding and the delay in the launch of 3PDI. Finally, it seemed that all programs are experiencing loss, either due to turnover, retirement, or attrition. We are hoping to fill some of the gaps in programs experiencing these loss. Next slide. Why practice partner services interviewing? These sessions were established to help support state, territorial, and local health departments with their DI training, with their disease intervention. You may hear me say DI, which stands for Disease Intervention Professionals, training while 3PDI is in development. We anticipate the sessions will continue once 3 PDI is available to augment the training. These sessions are meant to be supportive and can be used by new DI professionals and those who are experienced and may need a refresher or just want to hone their skills. We think this can be especially useful for smaller STI programs, including rural ones where there may be limited DI professional staffing and expertise. Next slide. Why practice partner services interviewing? As stated before, is to support the health departments to develop their personnel, bridge the gaps between online learning and mastering of skills, proficiency in asking those intimate personal questions, and also to enhance the impact of partner service interviews, eliciting data, which may be critical for some surveillance and program planning jurisdictions. Next slide. This is an overview of what the participants are in various roles. You have disease intervention specialists, or now we call them DI professionals, public health nurses or clinicians, CDS, communicable disease investigators or specialists, social hygiene technicians or case managers, and they are all in a variety of settings. They are in their state, local, territorial, county, municipal health departments. They may be located in rural and urban settings, tribal entities, non-governmental organizations. There may be personnel in correctional facilities. So these all individuals may need these skills in regards to talking to individuals, as stated before, who had tested positive for a reportable disease. Next slide. Who is eligible? So we were able to work with CDC Train to create a sign-up process for the sessions. And who is eligible to participate? Well, DI professionals from state, local, and territorial health departments or their delegated agencies are eligible to register for the program. The DI professional may participate in the program multiple times. Again, new DI staff with less than 2 years of experience are welcome to participate. The prerequisite for participation is that the DI professional should complete the DIS Fundamental Training Plan on CDC Train or their local equivalent of this program. Next slide. Here is a snapshot of what the course looks like in CDC Train, where an individual will go to register for the session. And this session here will explain to you the program and what all it entails on CDC Train. Next slide. So these are key components of the STI HIV interview. We create a free judgmental zone in which, when the participant and the facilitator are talking, they do not judge one another. It's a conversational interview session. We are to be aware of our own biases. They use gender affirming and inclusive language. We ask the open-ended questions like the who, what, when, where, and why to get the participant into a conversational mode. When you ask closed-ended questions, you get a yes, no, and really the conversation is not started. So we train an individual to use open-ended questions. Also and utilize the motivational interviewing techniques, which gets the participant to feel comfortable in talking about themselves, their intimate questions that are asked, so they don't feel that the facilitator is judging the individual. And so we get them to feel comfortable that this is a safe space to talk about intimate questions in relations to themselves and helping them to understand what they have come in contact with. Next slide. I've lost my slides. Hello?
Darlene, the person that was doing your slides just lost their connection. They're jumping back in. Maybe you can either keep just talking or share your slides. But you're explaining well, so I think you can just keep going until she gets back on.
Okay, I'm not for sure where we left off, but if there are questions as I go along in the presentation, please raise your hand or you can put them in the chat. And while we're trying to get back into connectivity, maybe I will be able to answer if there are any questions thus far from the presentation.
Arlene, the participants are in a webinar mode, so they can only put questions into the Q&A, and I can
Okay.
share those questions with you. And there is one question right now, and that question says, what's a social hygiene tech?
Social hygiene tech, these are names that the local area gives their personnel. A social hygiene may be an individual that's just talking to a person in regards to their hygiene, how to stay fresh, how to recognize if a bacteria or a odor may arise and they're not familiar with where it may have come from. Some of those titles, as I stated before, were given by the local area, but they do talk with participants or individuals, maybe in regards to a fishy odor that they're noticing, or how to wash a private area. And so that's just a name that they may have given to an individual in that job category.
I think, hi, everybody. I'm going to just jump into it and help frame this for Darlene. I'm so excited. And a big part of it, as what we do know, is there are so many, because DIS folks are pulled into so many different projects, it also means that we don't just have somebody who only does STI DIS now. We have health specialists. We have a myriad of different kinds of workforces in health departments. So every health department is calling them something different. To our benefit, we have all of these different experiences. So that's part of why we address this meeting today. Is we also know we have a lot of new folks. We have a lot of new folks who are eager and excited to try different trainings. And some of you who have been around a minute may even use this as opportunities to draw on refreshing or help mentor other folks in your areas. But this language of the DIS professional is always important to keep in mind, because we have nurses who do this work. We have other paraprofessionals. So it's a broad family who are doing this work because it's so crucial. And smaller health departments don't necessarily have individual staff. So I'm so glad you asked the question about the hygiene specialist. And Darlene, I think you got your slides up, but today is all about moving forward for 2024. Here are training opportunities, mentor opportunities you're going to hear from, and then I'm going to come back in a little bit later. And Darlene, unless Allie has an update, I think your slides are ready.
And I just want to say, this is Janine, and it was noted in the question and answer that Arizona actually uses the term social hygiene techs as the same as a DIS. So it is a DIS.
I thank my colleagues for adding to this. All righty. There should be a little bit more to this slide. There we go. So these are all the key concepts in regards to interviews to make the individual feel comfortable and have a conversation in regards to what they have come in contact with, how they can notify those whom all fit in a certain time frame in which they were intimate with, and how to be aware of recognizing what's going on with their body and the reason why a DI professional is getting in contact with them. So these again are some of the key concepts in regards to interviewing. And what's important is to set the stage for an ongoing discussion, because the initial conversation will warrant additional conversations later on. So you want the individual to feel comfortable and feel that they can come back to you, or if you have to get back in contact with them in the near future, that the conversation was welcoming, it wasn't intrusive, and the information that was shared both ways, two ways, was welcoming when you may get another call or face-to-face interview again with the participant. Next slide, please. So once enrolled, the facilitator will contact the participant's supervisor and the participant to ensure that the participant has met the prerequisitions, discuss the role plays that will be utilized, which one will be feasible, gonorrhea and chlamydia, or an HIV role play. And they will determine if there are any specific requests regarding the role play. They will be introduced to the feedback form, in which there is a verbal conversation with the participant, as well as a written feedback form that will be sent to the participant and the supervisor in regards to the assessment of what went on during the session, and if there are any other further questions. And on the feedback form, it does ask the participant if they would like to re-enroll in another session and how they felt about their session. So it is a two-way conversation with the facilitator and the participant, as well as with the supervisor. Once the supervisor receives the feedback form, if there are weaknesses in areas that the supervisor would like the facilitator to work with the participant again, as well as the supervisor knowing what areas that they need to work with the participant on as they further in their career. Next slide. So in the pre-interview, these are considerations that should be taken into consideration to assure the informed consent, orient the interpreters to preserve confidentiality, because that's a big question in regards to the information that is being shared, who all will have access to that. And confidentiality is reiterated throughout the interviewing process, so the participant will understand who all has access to the information that is being discussed in the conversation. If there is a change in interviewers, that is discussed with the participant. Setting boundaries, reporting inappropriate actions, that is a concern, and to refer concerns of information to appropriate personnel, because to let the individual know that everybody is not will not have access to the information that is being shared. Next slide. So this is the format in regards to a session. It is a 2-hour live video session. It is available in English and in Spanish. The role play with 2 participants and 1 DI facilitator, DERB facilitator. The participant takes turn playing the role of a patient and the interview. And the participant receives feedback from each other and the facilitator within the session. Next slide. This is just a snapshot of the interview format. There is the introduction, what all takes place. From there, there is the assessment of the disease, having the participant understand what they have come in contact with, what they tested positive for, what all that section consists of. Then there is the intervention, linking them to care and other services. And then there's a summary. So all of this is included, all of this is comprehensive of what the interview session looks like and takes place. Next slide. So the participant will practice building rapport with clients using open-ended questions. As I stated before, your closed-ended questions does not generate a conversation. So we teach the participant more of asking the who, what, when, where, and why. When was the last time? Whom you've all, instead of closed-ended questions. We're conveying accurate disease information in regards to their positive test result, what that means, how to recognize that in the future, problem solving with the participant if they feel that they can't tell whom all they've had intimate contact with, that they need to seek examination and or treatment. We problem solve with them during the practice session. Interviewing techniques is in regards to if the participant feels that they want to tell their partner. So we go over interviewing techniques in which the participant can talk with whom they've had contact with versus the DI professional. And then we provide and receive feedback, how the session went. Next slide. And these are the topics that are evaluated on the feedback form: their communication, how they communicated, how they relayed the disease information in regards to what they tested positive for and how they understood it, their analytical skills, their disease intervention skills, and the next step, which is a client-centered plan for the participant. Next slide. And this is just a guide in regards to diseases, the time frame in which the participant has to discuss with the client. Say, for instance, for the disease 710, primary syphilis, they're looking for intimate contacts within a 90-day period from when a symptom started with the individual. So these are the diseases that are reportable at the present time. Some programs do not run chlamydia. Some programs do not pursue individuals that tested for gonorrhea. Pelvic inflammatory disease, you may hear the acronym PID. Primary, secondary syphilis is important. So a lot of programs are concerned. A lot of programs interview clients that have primary and secondary syphilis. You may hear them say PNS, and then HIV or AIDS. These are the lines in which the interview time frame that they're informing the individual that tested positive in regards to whom all they've had contact with. Next slide. And these are courses that are offered through CDC Train. You can sign up for mentorship or skill building courses. My colleagues will talk about CETUS, NNDITC centers. They offer skill building courses also for the DI workforce. Next slide, please. These are some resources in which you can go online and look at the courses that they offer, skill building courses, as well as people-centered language. As we all know, there are a lot of acronyms that CDC utilizes. So there's a link here that you can look at a lot of the acronyms that are being used. And there are also resources and style guides for framing health equity and avoiding stigmatizing language. Next slide. And if you need to reach us, here is our email address in which you can connect with us in regards to any questions that you may have later on from this presentation. And I do thank you for your participation.
Thank you so much, Darlene. That was great. I don't think we have any other questions in the chat. Janine, please let me know if we do. And while we do that, I will pull up our next presentation. Oops.
It looks like we have one question, and it says 10-year interview period for 950 for spouses, question mark, exclamation point. So it's a question and a exclamation.
I'm sorry, what was the question again?
It's about having a 10-year interview period for HIV for spouses.
So for a spouse, if their partner tested positive for HIV, we are suggesting if they still are having intimate contact periodically to have a test done. What other questions do you have?
I do not see any more as of yet.
All right.
All right, thank you so much. I will turn it over to Wanda.
Thank you, Allie, and thank you, Darlene. Hello, everyone. Good afternoon. Thanks so much for being here today, and thanks for having me here with you today. My name is Wanda Jackson, and I am the program manager with the California Prevention Training Center, University of California at San Francisco Disease Intervention Training Center. That's a mouthful, huh? Well, today I am here to provide you with some insights into our training center to offer a brief overview of some current training offerings as well as some future programs and address any questions you may have about training that's available. So Allie, if you go to the next slide, I mentioned that I do work at the California Prevention Training Center, the UCSF DITC. So some of you may be wondering, who are we? I'm glad you asked. The California Prevention Training Center, DITC, is part of the National Network of Disease Intervention Training Centers, also known as NNDITC, which you just heard Darlene mention. We are actually funded by the Centers for Disease Control. And the NNDITC is comprised of a national knowledge-based curriculum development and training coordinating center, which is led by the National Coalition of STD Directors, or NCSD. And then we have a national skills-based curriculum coordinating center, which is led by the California Prevention Training Center, UCSF. In addition, we have 4 regional training centers, which are located and broken up by regions. And you can see here on the map that Region 1 is our Health New York, DITC. Region 2 is Healthcare Education and Training, or HCET, in Indianapolis, DITC. Region 3 is the Public Health Institute at Denver Health. That's our DITC there. And lastly, Region 4 is the UCSF CAPTC DITC. So you'll see here that the UCSF CAPTC, we serve in 2 capacities. We develop the courses, the skills virtual courses that I'm about to talk about, as well as we deliver these courses. And so that's why I'm here today to talk to you about what's hot, what's off the press, what's new, what's news you can use. So next slide, please. Let's talk about this. We receive many inquiries about how DIS should be trained in the absence of the flagship DIS training program, that Passport to Partner Services. And by now, I know you've likely heard of the principles, practices, and pathways to disease intervention, also known as 3PDI. This will be the training program that replaces the Passport to Partner Services training program. Now, we do recognize that this is an important course for the initial development of your staff, especially new staff, and that a lot of you might just be a little frustrated that it has not already been available. We hear you and we see you. What I can tell you is that 3PDI is scheduled to launch soon. Oh, now exactly how soon, I don't know. But we are looking at a 2024 launch date, so that's good news and news you can use, so hold on to that. Let me tell you what I do know. 3PDI, it's a blended program. It consists of online or e-learning modules, and then there's an instructor skills-based course that learners will attend after they move through the prerequisite modules. And those online prerequisite modules, of which there are 12, they are currently being programmed, and the skills-based portion of this blended course is working its way through the CDC clearance process. Now, because this is a CDC-funded course, this curriculum is undergoing a rigorous review. We have subject matter experts from all divisions across the center who are reviewing all 3PDI materials. That includes the online as well as the skills-based. So this includes subject matter experts from the divisions of STI, HIV, TB, hepatitis, as well as the Center for Preparedness and Response. So we have a lot of eyes on this. Next slide, Allie. Some of you may be asking, who is this training for? Well, now, while our trainings are geared to teach core competencies and job functions to DIS and other DI professionals, as a note, you heard Darlene mention, and you're going to hear me mention, DI professionals. We have begun to use this term, disease intervention professionals, in our training programs to be inclusive of all classification of personnel who was performing disease intervention activities. There's a variety of public health personnel classifications who may conduct disease intervention activities, including other non-licensed public health professionals like epidemiologists or linkage to care coordinators. We want them to take this course, right? And then there are licensed professionals such as public health nurses or clinical social workers. We want them also to take this course. In addition, public health programs may partner with external organizations to provide disease intervention services in a more, say, comprehensive setting. For example, contact elicitation integrated with HIV testing or HIV case management. They are also valuable to other audiences as well. There are public health professionals who are supervising DI professionals and working in positions which are adjacent to the work of DI professionals. They can benefit from having a better understanding of the role of this important workforce. Now, people who are working in workforce development or strategic planning, policy, and guidance, they may also gain insight regarding DI professionals and their role, which can actually lead to more inclusive response plans and policies. In addition, there are some community partners that work with the health department, and they interface with DI professionals, and they too can benefit from some of the training courses. So really having a better understanding of the type of services provided will help to enhance their comfort and their confidence with making referrals and sharing information. Ultimately, the additional information will allow them to discuss the services with the person that they are seeing prior to making a referral. And that's why we would want them at our courses. So these are all who we are considering DI professional and others. This is our training audience. Next slide. Now that we really know who these trainings are for, I do just want to briefly talk a little bit more about the 3PDI course that's coming. I do have to say, I think you'll find that 3PDI is more robust than the Passport to Partner Services program. And in this program, DI professionals will be introduced to a disease intervention workflow in which they will walk through the process of a day in the life of an STI HIV disease intervention professional. Now, in addition to this course, we'll also cover the core disease intervention job functions. And here, Allie, click. What will we talk about? We will collect surveillance and health information as well as community health data. They'll learn all about this. In addition, we'll also learn about how to provide education to people who are diagnosed with infectious diseases, specifically discussing activities which may put people at increased risk for infection, and then uncovering linkage to care and other support needs. So case interview. The next thing is to gain cooperation to identify, to locate, and inform people who are at risk for infection. You all are so familiar with the contact tracing, there it is. But not only that, others who could benefit from examination and or treatment. So we'll talk about clustering as well. The next thing they'll learn to do is to conduct case investigation and case analysis to discover opportunities to intervene in the spread of the disease. Also, they're going to be able to pick up that phone and collaborate with healthcare providers to ensure appropriate testing, treatment, and care is made for that person who has been diagnosed with an STI or HIV. Next, they'll be able to navigate healthcare systems to facilitate care coordination and provide other support referrals. And lastly, what do we do in all of our courses? We practice, practice, practice. They'll have an opportunity to practice an original interview, a re-interview, a cluster interview, as well as practice performing field investigation and other field-based activities. So I have to say that this is a really full blended course, and I'm so excited that we're going to roll this out soon. Now, initially, the rollout of 3PDI is anticipated to take place online in a virtual format. But there are plans for eventually transitioning this to an in-person classroom session in the future. But right now, folks, hear this. It's going to be virtual, okay? The course structure aims to optimize the virtual classroom experience by minimizing prolonged seat time. So what am I saying? Learners will alternate between studying and practical application throughout the course. In other words, learners will study some and then they'll practice some. So they'll take those online modules, those e-learning pieces, and then they'll enroll in an instructor-led skills base, and they'll do that back and forth. Next slide. Now, I do want to state that 3PDI will not, I repeat, will not be the end all be all. You all hear me, will not. There are additional courses that DI professionals will need to take. There are other cross-cutting competencies. There are other knowledge, skills, and abilities that DI professionals will need to build for practice proficiency. What is one? Data, security, and confidentiality. Number one. What else would DI professionals really need to know? Empathetic engagement and cultural humility. There's a course that's coming out on that, and I strongly encourage DI professionals to enroll with that. What else? Infectious diseases. You have to know the signs, the symptoms, the transmission, everything about it. It's going to be in 3PDI, but it's not the end all be all. We got to get more. What else? Active listening and open-ended questions. Sure, that's in 3PDI. That's what we do. But this is a knowledge, a skill. This is something that we're practicing on a regular basis. What else? Prevention, care, and treatment tools. We got to know about PrEP and PEP and everything that's out there available. We're not going to get it all in 3PDI. We have to go out and engage in other courses. What else? Motivational interviewing techniques. Exactly. We are using motivational interviewing, but we have a course that is designed to teach us those techniques that we really need. So we want and we really encourage DI professionals to attend that course. Then there is the cluster and outbreak response strategies. What happens in the case we have another COVID or pandemic we need to be able to address and know what strategies, how to respond. We need to take that. And then there's person-centered communication. How do we really communicate with those that we are trying to serve? We want to be person-centered. So we want to make sure that we have the skills and abilities to be able to do that. Another thing is the social determinants of health and health equity. There are a lot of courses that are available now that DI professionals could take to really enhance those skills and abilities. And then lastly, critical thinking and problem solving. I think this is one of the most important skills, and this is what I really encourage DI professionals to really focus on, those critical thinking and problem solving skills. So just as a reminder, DI professionals have a lot of knowledge, skills, and abilities that we really want to build for practice. Thank you. So next slide. As you await the 3PDI program, and I want to say thanks so much for your patience. In the meantime, do we have something to offer you now? Yes, we do. There's a 4-part STI HIV interviewing learning series that has been developed, it's been launched, and we have been delivering this training, and it's on the training calendar for the next several months. Now, these are short programs. They're approximately 4 hours each in length, and there are no online modules that are connected with it. These are not passive webinars. Learners will be fully engaged and they will be strongly encouraged to participate. These are virtual skills-based programs that include interactive activities, case studies, games, large and small group discussions, practice sessions, and there's a great deal of examples of how to respond to people that DI professionals serve, with a great deal of job aids and handouts you can take along with you that's going to help you do your work. Now, these 4 courses are standalone courses, but I do strongly recommend that they be taken in this order as each course builds upon the other. If you are interested, this interviewing series is on the calendar and it's waiting for you to register today. You can just hit on that link that's at the bottom of the page and go there now. Next slide. What else, Wanda? What else do you all have to offer? Well, I'm glad you asked. There are 4 topics that get addressed through 2-hour virtual skills-based learning courses, and they rotate weekly. We do these courses on a regular basis. The first is strengthening cultural humility awareness when working with men who have sex with men. And this is intended for providers who are interested in exploring and learning how provider values and stigma can impact HIV care for the MSM community. We then have cultural humility, an approach to working with people who use drugs. That's a good one, where we really are focusing on 3 principles of cultural humility, motivational interviewing, and person-focused harm reduction. How about that disclosure of STI, HIV status within the context of self-referral? How many of you have actually had people tell you, I want to tell folks myself that I tested positive? Well, here, this provides skill building opportunity to assist disease intervention professionals in supporting people who are diagnosed with an STI HIV who want to share their health status with people in their social and sexual networks and inform them of their exposure to infection so they can seek testing and treatment services. And then lastly, my favorite is maintaining personal safety during field notifications. This was designed as a really proactive response to the increasing potential for incidents of violence and threats of injury for DI professionals who actually conduct in-person partner notification services, outreach, and other public health related activities in the fields and the communities they serve. Now, I hope some of you have attended these courses. If you haven't, come on, register today. See the link below, click it, and come on and join us. Next slide, Allie. But wait, there's more, huh? I sound like the commercial, I know. There are 3 other instructor-led skill-based courses that some of you may have attended and that we offer. The first one is SOGI. Actually, the title is Demystifying Sexual Orientation and Gender Identity for Disease Intervention Providers. Just that title alone makes me want to come. I'm interested. I'm there. We also have the motivational interviewing for disease intervention providers, as well as a self-care for disease intervention providers. And as a former DIS, I really would have welcomed a training that focused on self-care, but I'm so glad that we have it now. These courses range from 2 to 4 hours, and they involve a great deal of interactive activities and discussion, and they're useful for all levels of DI professionals who are conducting communicable disease work. Next slide. Just in case you didn't know about some additional resources, here they are. There's a National HIV Classroom Learning Center that provides training and resources to help healthcare agencies reduce new HIV infections by implementing interventions that are evidence-based and supported by CDC. There's the link there. We want you to click on it. I do want you to know that there's a course that's coming out. It's called Data to Care and Cluster Response. It will be piloted in June and then launched on CDC Train shortly thereafter. And it's also listed on the CAI training calendar. So click on that, go there. Also, the Tuberculosis Center of Excellence for Training. Wow, we can find out so much. They provide training activities related to tuberculosis knowledge and contact investigations, including the TB contact investigation interviewing skills course. So more resources, and take a look at those learning plans. There's an introduction to public health practice training plan, which provides an introduction to public health for those new to public health or working in the field. And it includes courses on health equity, on communication skills, on policy development, data analytics, and more from various public health organizations. For new DIS, there's the DIS Fundamentals Training Plan, and this is a 29-module self-paced training that provides fundamental information for new DIS and or those conducting partner services. And then the Disease Intervention Training Plan with Outbreak Response. So click on those, go there, please. We do have all of these resources available for you after this call. But click on those links now if you like and see what's available. Next slide. I know I went really fast, but this will be recorded. It is available for you. I hope you found these training resources very useful as you do consider how to begin or to continue with the development of disease intervention skills across your program. There is a lot of training available, but there's a lot more coming. Please join us. We'd love to see your faces in some of those spaces. Thank you so much for your time and attention. I appreciate it.
Thank you so much, Wanda. That was amazing. You're getting a lot of kudos and shout outs in the chat about how people have trained with you, and they're so happy to see that you're still here. And so just know that, and I hope you can see that. And then I'm also going to turn it over now to Janine to go over any questions that came in.
Yes, so there's several from an individual. So I'm going to read down the questions. I'll read multiple questions from the same person. It's related to the same thing. It goes, how are the new DIS being trained to do field work in this new DIS training? And then it says, in the cross-cutting competencies, will field work be covered? And they feel like it's not being covered. So I guess basically, can you describe how hands-on field work will be covered in these trainings?
Yes, thank you, Janine. And yeah, field work, that was my favorite area when I was a DI professional because I am one of the co-developers of the Passport to Partner Service. I'm sorry, not Passport. Well, I was for Passport, but for a 3PDI. I felt that it was really important that field work is inserted in here. And so there is a big, huge piece of field work that will be in the 3PDI program where we will actually have learners move through a simulated field investigation case study, as well as they will move through working with a couple of different people who are diagnosed with STIs and HIV, and they will actually have to go to the field. Of course, we can't, physically go to the field, but we will have them pretend to go to the field and discuss what steps they will take. We will talk about the 7 steps of field notification. We will come up with different scenarios and things that will occur in the field and how those will be addressed. And just know that it's very robust and they will get a clear understanding of what could happen while they're in the field, how they should maintain their safety when they're in the field, the importance of getting to the field and conveying that sense of urgency while they're out in the field. Does that answer your question?
Well, while I ask the other questions, we'll wait and see, but it sounds to me like that is answering the questions related to field training. And then the next question is, when is 3PDI being released? And the person said that they feel like the old lady in the Titanic, it's been 84 years.
Yeah, I'm right there, right along with you. I can say, as I said in the beginning of this presentation, that 3PDI is going through a rigorous review. There's a number of subject matter experts that's looking at this. To answer your question, we don't know the exact date, but we are expecting that it will be launched in 2024. We're in March 2024, so we have a few more months. We're hoping that we can get it out. Even if it's December 31st, 2024, we're working on it. But 2024 is the hopeful launch date.
Okay, and yes, you did answer the question about the field, and you got to thank you. So yes, so I appreciate that. And then the final question that I have so far is, where will one be able to access the data to care and cluster response coming in June?
That will actually be on the CAI website. And after this call, we will provide you with that link where you can go directly to the CAI global.org link. You can click on there. And as I mentioned, this course will be piloted in June, and then it'll be launched on CDC Train shortly thereafter. So I'll ensure that Allie provide you with those links. Any other questions? What other questions?
Not at this. So there was a follow-up from the question earlier about the interview period for those who are HIV positive and or 950. And I'm just going to read the follow-up because maybe just so the question was that 10-year interview period. And someone responded and said, yes, that is the recommendation. However, most programs will reduce the interview period based on history of negative tests. So I just wanted to.
Yes. And Ralph, I saw your response about, going out into the field, not virtual. Right now, there's no substitute. We do have just everything virtual. We've been funded to do things virtually, but we are hoping to eventually get back to maybe doing some in-person field trainings, and I can connect with you offline about that. Other questions? Okay, thank you all.
Thank you so much. And I know we're getting close on the hour here, but I am going to turn it over to Frank now just to kind of give us an overview of what's to come in 2024.
Thank you. And first of all, I'm just like catching my breath because between Darlene and Wanda, I'm exhausted on so much energy that has happened. I'm very excited. But what I really think why this was important for me today to hear and share this with our time with all of you is being a trained DIS professional isn't a one job. It isn't one-time training. You want to advocate locally with your health departments for more workforce training for you. Some of them are free. Some of them do require a little extra effort on your, many of you are carrying multiple cases and multiple pouches. And I get that. But the reality is that every day you're in the job, new things are coming up. We're in a constantly changing environment, constantly changing communities that we're trying to reach. And these skills are important to keep up. I'm the first one to say another training, but it pays. So it really was to help revitalize and remind that we have some new materials coming, we have existing training opportunities, and really advocate at your local and state to make time in your days to take these trainings. When it comes to digital, if you're following the news, we know that there's training. Several years ago, there's a lot of shifting going on. Several years ago, we saw Grindr get caught in the whole ownership sale of foreign owners. Now we're seeing this reality come out again with TikTok, and this will play out when the big players are foreign owned. And actually, some of the major social apps that we may utilize moving forward are not necessarily owned in the US. So, stay tuned as these kind of things come up. We'll be trying to build them in. What I'm hoping, and I know we're running close on time, so what I'm going to do is, if you you can send me an email, or you can send an email via our toolkit. What are some of the things that you are interested in our next couple months to bring forward? I know we're looking at some new apps. We've got a lot of folks as they're retraining, they're getting back, we're hopefully not going to have a spin with any other pandemics, are rethinking their protocols for digital partner. Remember, DPS, or digital partner services, is not a replacement for real-time partner services. It's an enhancement. It's just one of multiple skills. We will be, reaching out to health departments again, especially those of you who sort of had to pull back for a bit because of staffing, contracts, things like that. But if you have specialized interests, if you have protocols that are stuck or need to be written, if you wrote your protocol and it's going to stop there and it needs to get a bit of juice or energy behind it, start to reach out to me again. We're looking at some of the new techniques. We've seen many of the apps like Scruff and Grindr have started to add new fields. They've become more open around orientation. So you're going to see an influx in being able to reach trans folks much more visibly. You're also seeing that many of them have started to add fields around where people's vaccination statuses are. Are there still challenges? Yes. Grindr still is not searchable. We know that. So if all of your cases are in Grindr, it may not be a useful tool to kind of motivate to a lot of effort, but there are workarounds. And so if there are special areas that you really have some specialty topics you'd like to see us address, we have 3 more of these NIPS calls. We even might be able to slide in a 5th. We may be rolling out some office hours that are just a generic office hours that you can join myself and some of the work, the UTABS work group, talking more to just, brainstorm ideas. We've got a bunch. We're also getting ready to redo the entire website. It's been several years since the toolkit for UTAPS has been updated. We're getting ready to begin work on that as soon as the CDC's master overall clean sweep has finished. Then we'll be able to update. So if you see places that you'd like to add or change or update on our site or have suggestions, feel free to reach out to me. My email is fhs3@cdc.gov, and you can always email us directly through the website and the toolkit. With that, I don't want to keep people longer. Those are some of the highlights, but if you have some things you want to drop in that I'll take notes on in the meantime, to move forward. But I really just want to personally thank our speakers, Darlene and Wanda, and Janine and Ali for organizing this, and Romney for jumping to support this. We really do understand that our partners in the health departments need access, they need training, they want training. And that's why we felt it was kind of an important moment in time today, even though we focus on the digital side of that, to say there are digital tools available to you learn, but we want to let you know the learning is coming. It's there. And I happen to have seen some of these already, so I already know I'm happy with them. With that said, great. Thanks for putting up the slide. There's our quick slide set with our emails as well. I think that's it. And I just want to say thank you to Leo as well. Go ahead.
This is Janine. I also wanted to say, while you see the email addresses up, that not only if you have a question or something you'd like to address in this, but if you actually have something that you would like to present related to digital partner services reach out to us as well. We would love to have on the ground presenters.
Yes, we're always loving to have at least one from the ground, from the field talk every episode of our talks. And I do want to recognize our partners at NCSD, Leo, and all of the team at NCSD. They're an incredible partner on our calls. They host the calls so that it allows you to be able to see in retrospect, play these back, share these with new staff moving forward. They've been an incredible partner of ours for years. And so I do want to acknowledge them, even if they're not necessarily speaking formally. They do manage all of our background right now, and they are totally our partners in health when we're looking at DIS. And don't forget, we've got Engage 24 is getting ready to be planning. So start thinking about Engage. We've got STI and HIV conferences this year. It's going to, I think there's both this year. I know their STI is. So you've got some, you know, some in-person training coming up as well to think about. That's it for me.
All right. Thanks, everyone. Reach out if you have any questions, and we'll see you on our next call. Take care.